My name is Dr. Shah. I'm a board-certified plastic surgeon with a subspecialty board certification in hand and upper extremity surgery. I'm the chief and medical director of the Center for Hand and Upper Extremity Surgery. So, radial tunnel syndrome is defined as another pinched nerve that exists in the forearm. You may have heard of cubital tunnel syndrome or carpal tunnel syndromes, which are very common conditions for pinched nerves inside the hand or the elbow. Radial tunnel syndrome is really defined as a pinched nerve of what's known as the posterior interosseous nerve. There's a lot of patients who have a significant amount of forearm pain, elbow pain. They may have been told that they had tennis elbow in the past, got treatment, didn't get any better, and oftentimes this is where radial tunnel will show up. Eventually, as time goes on, if radial tunnel syndrome is unchecked and untreated, you'll actually start to get some weakness with the ability to open your fingers, and slowly but surely your fingers will drop down. Radial tunnel syndrome is a hard diagnosis to come by. A lot of patients have significant amount of pain and discomfort without realizing that they have this condition. And the treatment is difficult unless you have somebody who's specialized in treating it. There are some physical therapy and occupational hand therapy options in order to alleviate some pressure on the condition. The surgical treatment of radial tunnel syndrome involves a decompression of the nerve that's being crushed. That's an outpatient surgical procedure. It takes about an hour or so of time in which we make a small cut on your forearm and get down to the nerve in the area that's being crushed. We release the compression by releasing the muscle that's crushing it, and that's really the entirety of the procedure. The nerve gets a chance to breathe a little bit better, you get some stitches in the skin, and then you go home the same day. The surgical recovery after a radial tunnel decompression is pretty minimal. There's a few days of soreness that you'll have when you go home, almost like you worked out too hard. That's kind of what it feels like when the muscles are decompressed and stretched out. You're allowed to use your hand and your arm basically the next day for all basic level activities. We ask you to avoid heavy lifting for a couple of weeks, but really after a week or two, most patients say that they feel great and they return back to their normal levels of activity. We believe that patients should come to the Center for Hand and Upper Extremity Surgery to get their radial tunnel treated, mainly because most providers out there can't diagnose this condition. We see so many patients who come in with this severe, deep aching forearm pain, and they've been told they have tennis elbow, they have a tendonitis, they have problems with the bones, and when we get an opportunity to see you or see them, we have a very clear ability to make the diagnosis with certain tests, certain nerve blocks. And when you do get that diagnosis, there's a very clear pattern for treatment. The most difficult thing that we find is making sure patients actually know what this condition is and that it can be treated and they don't have to live with this deep aching pain for their entirety of their life.